Hi, I'm Dr. Hart Kress. I'm a board-certified women's health nurse practitioner, and I own Christine Hart DMP LLC, a concierge midlife and menopause telemedicine practice.
What is the difference between perimenopause and menopause, and why does the distinction matter so much?
So menopause is 366 days of no period. That marks the end of your menstrual cycle, the end of your follicle count. You have no more, I call it eggs in the basket, and you're no longer producing hormones. And yes, you can make it to 364 days, have a period, and start that clock all over again. Perimenopause is, on average, it can be up to 10 years before that final menstrual period, but for most women it's somewhere between 4 and 7 years where they start having fluctuations in their hormones and they start having symptoms. And I think that it's important to understand that there is a period of time before the end of your reproductive life, because it's a prime opportunity to get ahead of the game and to not have any gaps in your hormones.
What does good menopause care actually look like, and what should women be asking for?
So it begins with a conversation. A provider who's willing to have the conversation, and the caveat, if you want to have that conversation, you cannot pair it with other things in your visit. It can't be paired with an annual exam. It cannot be prepared with a problem visit. It needs to be a visit where you specifically book for, I want to talk about hormone therapy. Because a woman deserves education on, what are your symptoms? A deep dive into your symptoms. What are your risk factors? There are some contraindications. There are some times in a woman's life where hormone therapy is not the best for them, or where it may cause them more danger than be more helpful. It's very, very rare, but there are those situations.